So welcome. I'm Karen Shannon. I work for the Needham Public Health Department. I'm a senior substance use prevention coordinator for the town of Needham, and I also oversee the Substance Prevention Alliance of Needham, also known as SPAN. Just a few notes about our Zoom meeting this morning. This workshop will be recorded. We ask that you stay muted. I believe everybody is at this time, but we appreciate you staying muted while you're not speaking. We will have time for questions and answers following the presentation. And we encourage you to please type any questions into the chat while the presentation is unfurling, and questions will be shared at the end. We will also be sharing an event survey link with you that we would be very appreciative if you take a few minutes to do. It's just a few questions long. All righty. So welcome. The Substance Prevention Alliance of Needham and Natick 180 are proud to bring this important topic to the community. The event comes from our regional collaboration between our two communities, as we're all facing similar problems around youth substance use. We're pleased to bring our coalitions together to engage discussion around teen marijuana use. The focus for today's presentation is on cannabis and the developing teen brain. And while those of us gathered on the call might come to this topic with varied experiences and opinions about cannabis policy, its medical use or non-medical uses, and its classification at the federal level, our goal today is not to debate any of that. Rather, the goal is to hear from a practicing pediatrician about what we currently know about cannabis and its impact on adolescents and their brain, as well as hearing observations from his own experience working with this population. So again, thank you all for attending. We're very excited to hear from Dr. Safdar Medina. But before we get started, I'd like to quickly introduce a few people with us this morning. First of all, from Natick 180, we have Katie Sugarman, who's the Prevention and Outreach Program Manager of the DFC program. That's the Drug Free Communities grant for the town of Natick, and she works in the Natick Health Department. We have Nina Levine. She's the Associate Project Coordinator of the Drug Free Communities grant, also for the Natick Health Department, and Astrid Dretler. She is the Administrative Project Coordinator for this team in the Natick Health Department. We also have from our Needham Coalition and Public Health Department, Monica DeWinter and Karen Mullen, both project coordinators, and Angie McDonald, who is our vaping grant coordinator. And lastly, I'd like to introduce Dr. Janet Jankowiak. She is not only a SPAN steering committee member and member of the community and youth action teams for SPAN, she's a behavioral and geriatric neurologist, retired from clinical practice, but she's writing a book for the lay audience on maximizing brain potential across the lifespan. And I'm going to turn it over to Dr. Jankowiak so she can introduce our featured presenter this morning. Thank you. Oh, I think maybe she's muted. Let's just
unmute. Okay, thank you, Karen.
Thank you.
Karen mentioned rates of cannabis among our children are increasing. They need us more than ever to support, protect, and advocate for them. As parents and caregivers, we are in a great position of responsibility to learn about the impacts of cannabis through the lens of brain health and adolescent development. As a behavioral neurologist and particularly interested in protecting the brain and maximizing its potential, I'm very grateful for Dr. Medina to be here today to talk to us about this very important topic. Dr. Safdar Medina is a general pediatrician and assistant professor of pediatrics at the University of Massachusetts Medical Center. He is the medical director of the pediatric department of Tri-River Health Center in Uxbridge. He is also the school physician for Northborough and Southborough School District and member of the Northborough-Southborough Substance Use Prevention Coalition. Dr. Medina shares a special interest in pediatric mental health and substance use. He is also the parent of 2 teens. Thank you, Dr. Medina, for joining us.
Thank you all for allowing me the opportunity to be here today. I will get started with a presentation on the general landscape of adolescence and marijuana, and in particular, looking at some of the physical, emotional, and neurological impacts that cannabis can have on their brain. Um, so to get started, just a brief little thing that we all know about the marijuana plant. And what I find interesting before I present this slide is I learned about this slide from a patient. So I know how little I know about the marijuana plant, how much education I need. But there are two basic components to the plant. One is THC and the other is CBD. And THC is the part of the plant that we really worry about. That's the that's the part with the psychoactive properties that can cause harm to the adolescent brain. And then there is the CBD part of the plant that has, while it has no psychoactive properties, may have some medicinal role that's being studied, particularly in adolescents and children. We don't have data on the safety of CBD quite yet. And the street names are sativa and indica, and sativa indicates high THC and sativa indicates high THC and indica indicates low THC. So teenagers often use these terms very easily, so it's important for us to understand them. So the big question, and we all know this already, is why do teens use drugs? Because they are thrill seeking, peer pressure, instant gratification, all these things are part of who adolescents are. They generally have poor impulse control. The population that starts to worry me a lot is the ones that are using this for self-medication for anxiety and depression. A lot of teenagers that use marijuana will use it to self-medicate anxiety and depression. A lot of them are using alone at times. And the final thing to really note is media. Media has a powerful influence, just as it does with alcohol and tobacco, on teenagers. So, well, all right, so this next slide I really like. It's data only till 2016, but it highlights one of the really important things that we worry about, especially on this right-hand side, is the risk that teenagers see from marijuana. Now, as you can see, the risk peaked around the 90s, and it's gradually been declining to the point where in 12th grade, only 30% see risk in using marijuana regularly in the 12th grade population. And in 8th grade, I think that's really surprising that only 60% of 8th graders see risk, and 40% of 8th graders think it's safe to use marijuana regularly for them. If you look at rates, they dipped in the 90s and they've sort of held steady, maybe with a slight uptick after 2016, which we can look at some data for that afterwards. So, the big question is what's going on? Why is this perception so less? A survey was done by a substance use organization in the Cincinnati suburbs, and they surveyed a bunch of teenagers, found 100% of them had been exposed to marijuana advertising at some point. There's a lot of messages on social media, and as well as medical marijuana ads that are for adults, but teenagers are obviously seeing those. And, something like an ad like this with a football player, is obviously very appealing to adolescents. Well, Instagram doesn't sell these products. They are advertising them where teenagers can see them. This survey of 5,000 middle school students in California that were followed from 2010 to 2017 showed that the number of teens who had seen an ad increased from 25 to 70% during that time period, corresponding with increased use and a higher rate of negative consequences. So, the effective legalization of recreational marijuana has been looked at in California now with a survey of 3 million adolescents in 7th, 9th, and 11th grade. And they found between the two time periods, 2017 to 2018 and 2018 to 2019, a 23% increase in past 30-day marijuana use and an 18% increase in lifetime use. So again, this is really the perception that teens are getting from these messages that we do need to worry about in our education efforts. So I love this next set of pictures that I have are from a collaboration in Ohio that talks about substance use in general and what teens think. And I think these are messages that I get from teenagers every day. And the first one is marijuana is not as bad as other drugs. And my usual answer to kids, while it may be not as bad, it's still bad for you. And so I asked them to look at what's better. Is smoking weed better or not smoking weed better for your health? Let's just look at this as a comparison, not marijuana to other substances. And it's sort of the analogy for a teenager. Would you rather jump off of a 4-story building or an 8-story building? But again, it's counteracting some of the ads and messages that they see that you can see on the left hand of the slide, that alcohol kills, cannabis chills, or, quote unquote, good weed. Get a lot of this from teenagers that, well, marijuana is natural. And yes, it is natural, but natural things aren't necessarily safe for you. And I really talk to them about poison ivy. Heroin is actually a natural substance. There are a lot of poisonous berries out there. And one thing for teenagers to remember is, we have marijuana that's much more potent than it was back in the 1960s. And there's been genetic modification to that plant to make it more potent than it was decades ago. But again, we're counteracting some of the ads that they see about marijuana. A big thing I get from kids is marijuana is not addictive. It is addictive, and studies do show that for teenagers, 1 in every 6 adolescents who use any kind of cannabis product will develop an addiction. And I get this a lot, that no one dies or ODs using marijuana. That is probably true, that you may not die if you overdose with marijuana, but we have to remember that psychosis in teenagers can be caused by even a single ingestion of edibles or one instance of dabbing or vaping a high potency THC product, and actions from those psychotic events can potentially lead to death. In addition, looking away from the adolescent population, there have been a lot of young children overdosing on edibles in emergency rooms because they're readily available. And the final one, marijuana is a medicine. And to this point, I say to adolescents, it is not safe yet for you as a medicine. I don't have the data to tell you that it's safe for you as a medication. In children and adolescents right now, the only FDA approved use for CBD is for a special category of a seizure disorder called Dravet syndrome. For any medication, you really need a dosing regimen and an ability to monitor side effects. In the pediatric and adolescent population, there's no data supporting its treatment for anxiety, depression, or chronic pain. And what we have found that states that legalize medical marijuana also end up legalizing recreational scales. So sometimes that definition or that differentiation between the two is not always clear to teenagers. And again, it's important to remember that nicotine was promoted as healthy by the tobacco industry as well. So I think that finding that fine line between its really limited medical uses and recreational use is key to educating our teenagers. The final one I get a lot is marijuana is legal. And, to that, I have to say that it is legal, but it doesn't mean that legal drugs are safe. And the same conversation that I have with you about cannabis, I have about alcohol and tobacco. That conversation is no different. And those are legal substances. Where are we in Massachusetts? So the 2019 youth risk behavior data as a state, and I think a lot of local areas have their own data, is that before age 13, about 4% of teenagers in the Commonwealth had tried a marijuana product. And you can see the breakdown here by grade between 9th to 12th grade, going up to 65% have ever tried it by 12th grade. And the past 30-day use overall in adolescents is about 26%. So, never underestimate your role as a parent, ever. A study showed that teens whose parents talk to them regularly about drugs and alcohol are 42% less likely to use them. So that's why these conversations are so important. And they need to know that you're on their side. Tell them that you really care about their health, wellness, and success, and being as open and honest as possible. I think I missed a slide here. Yeah, sorry. So talking to teens who use marijuana, how do I do this? So I have very open and honest discussions with them with very factual information. There's no judgment at all or any punitive action. I really encourage parents not to use that as a route, but to educate and move forward. There is a very limited role for drug testing, and I will tell parents, if you're suspecting, please don't get a drug test and drug test them. Talk to them and talk to their healthcare providers. I do offer testing to kids if they want to get tested. And what I test for is actual quantitative levels of marijuana and its metabolites in their urine. So if I can see a level of 400 and they see it coming down 3 weeks later to 200 and they feel better, they actually see that as their marijuana levels decrease, they start feeling better. So that's how I use it. Motivational interviewing is a great technique that can be done in primary care. You know, having them find that one thing that means the world to them, whether it's playing soccer or, you know, getting an A on their AP exam or whatever that goal is. It probably is better achieved if we can help you avoid using cannabis products. For teenagers who need more, the ACRA treatment approach is an approach that's been well studied, that a number of mental health clinicians can provide through various agencies, and I believe you can look them up. And it's a 14-week program that includes parents as well in the process. And the big thing about this is, of course, it's treating underlying depression and anxiety. So acute physical effects of marijuana. So I want to take a little different approach now and talk about what some of the real harms are. So when a teenager ingests marijuana, they will have increases in their heart rate, and their blood vessels, the blood vessels in their eyes expand. So you do notice that, you know, that bloodshot look in their eyes. Respiratory side effects. This is one that a lot of people ask about. And, you know, what I do tell folks a lot is that, you know, many of the same harmful carcinogens that are found in cigarette smoke are found in marijuana smoke. The carcinogenic effect is still unclear, so there's no link that's been proven between marijuana smoking and the development of cancer in the lungs, but it does weaken the immune defense systems you have in your respiratory system, and regular users are more likely to experience cough, wheezing, and exercise intolerance. Gastrointestinal side effects. This has become an increasingly common story in pediatric primary care, where we'll see a teenager present with vague abdominal symptoms, including vomiting in the morning. Typically, we go through a huge history. We usually don't get any other, you know, causes. We'll do tests and workups, and we find that they are using marijuana. And these kids, unfortunately, don't make it to school every day, which is really difficult. But what happens with them is something called cannabis hyperemesis syndrome, which is now being identified more and more. This is a 2012 case report that was the first one that was out that looked at some of the symptoms that this can cause. Almost all of them had some kind of vomiting or nausea, morning symptoms, pain, diarrhea, and interestingly enough, relief with a shower. And they do. Once they get up in the morning and have their symptoms, take shower, they're 100% better. But as you can see, those that use it daily have a 60% chance of developing this syndrome but even those that use it, you know, less than 1 time per week still potentially can get it. So UMass Memorial data has shown that, and this was an article in the Boston Globe from November 2019 by a pediatric GI doctor that I work with, reported seeing 1 admission a week for this condition where they were dehydrated and needed IV fluids. And in a 2018 study, 155 adult users of marijuana who used 20 days per month, 33% had symptoms of cannabis hyperemesis syndrome. Moving on to the brain. So we know the brain is hijacked. Did I miss a slide? Yeah, sorry, there was a slide that was missed. My apologies, it went too fast. Endocrine side effects. I did want to talk to this very briefly because this happens in boys, and I use this a lot, that it does cause a dose-related decrease in testosterone levels, can cause erectile dysfunction, low sperm count, gynecomastia, development of breast tissue in adolescent males. And I've had 2 patients have to have surgery for removal of that breast tissue as a result of cannabis use. And there is a higher risk of certain types of testicular cancer in their 20s. So the brain is hijacked, which is something that we know. Use of marijuana or cannabis can cause dependence and addiction. The brain becomes accustomed to these new compounds that it sees. And, you know, we have cannabinoid compounds in our brain that help our brain function, and we lose the natural ones that occur in our brain, and our brain relies on substitution from the ones from THC. So the effects of THC in the brain, it affects certain parts of the brain, the hippocampus, the orbitofrontal cortex, and these are areas that enable a person to form new memories, to maintain focus, and it affects their ability to perform complicated tasks. We also see disrupting in the cerebellum and basal ganglia. These are brain areas that regulate balance, posture, coordination, and reaction time. So psychiatric and neurological effects, and I use the word brain as hijacked very, very commonly with kids so that they know that really this is a hijacking of their brain. Lowering of their IQ up to 8 points, and this is irreversible. This goes on into adulthood. Increased incidence of psychosis by 41%. I've had a few patients with some really heartbreaking psychosis that needed, treatment, long-term treatment to help. Increased incidence of anxiety and depression in those who use, and obviously developing a substance use disorder, not only with marijuana, but with other substances. I use this term a lot with kids, dumbing of the brain, realizing again and really telling parents that this is very potent marijuana compared to what it was in the 60s and 70s. Your brain loves it. It crosses the blood-brain barrier almost instantly and binds to receptors in our brain for long periods of time. And in the Journal of School Health, and a study of high school students showed that those who used marijuana casually, even on weekends, had lower test scores than those kids who didn't. So there's a lot of idea of smoking on the weekend and then being okay for the rest of the week. Impaired driving is another issue that comes up a lot. So Colorado and Washington State have kept track of their fatal car crashes, and Colorado found 18 in 2013 and 77 in 2016, and those drivers tested positive for THC. And in Washington State, it was 9% in 2012 and 18% of all drivers in 2019. So a real risk for cannabis and driving. And again, this is the message that I get across to teenagers all the time. It's just like alcohol. We do not want you to drive under the influence of anything. So cannabis use disorder is a disorder that I'll define in a little bit, but that really implies someone who can't stop using cannabis that's affecting their life. And 30% of those who use it can develop this disorder. And those under the age of 18 are 4 to 7 more times likely to develop this than adults are. So what this shows is that these are the symptoms of cannabis use disorder that you need to worry about. There's a craving or strong desire to use the substance, unsuccessful efforts to cut down or control the use, failure to fulfill obligations at work, school, or home, declining in grades, giving up activities they used to enjoy, like soccer, sports, music, whatever they do, continued cannabis use despite social problems, the child that starts to use it at school because they can't stop, or someone who starts driving with it, the development of tolerance, so needing more and more to get the desired effect, and withdrawal from marijuana, because you can withdraw from marijuana. And then here's what happens when kids stop. They do start getting symptoms of withdrawal. On day 1, they'll get very anxious, irritable, trouble sleeping. Day 3, they start getting cravings, sweating, and chills. And then the long-term effects can kick in, which is, significant depression that usually requires some kind of treatment. But I really try to get kids through this and saying you can get through these first few days and we will help you as you withdraw from cannabis. This question comes up a lot, and it leads to a lot of discussion with teenagers and their parents. Is marijuana a gateway drug? Short answer, yes. It is typically used before progression to other drugs. We know that early use can lead to increased vulnerability to addiction. You get increased nerve firing and dopamine surges when you start using THC. And then your brain remembers that dopamine. It blunts its own ability to have that dopamine released, and you crave more THC and eventually crave other drugs to get dopamine surges in your brain. But it's important to know that most users of marijuana will not go on to use other drugs. And it's also important to note that it is not the only gateway drug for teenagers. Alcohol and nicotine are also gateway drugs. This study was published in 2018 that actually showed, after a 3-year follow-up, that cannabis use was actually associated with an increase in opioid use disorder. And I think that's really important to know, especially with teens and young adults. And, I have a Suboxone waiver provider, so I provide medical treatment for teenagers and young adults who have opioid use disorder. And in my patients, they all started with marijuana or alcohol as teenagers before going to opioids. So this is real and something we do have to be on the lookout for. So what kinds of things are teenagers doing. So dabbing has become a new thing that teenagers use, and it's actually very easy for them to learn online how to dab. You know, they'll use a torch to heat the oil. They dab a small extract in, and then they can inhale it. And the problem with this is that there's 95% THC in some of these extracts. It's odorless, so it's not detectable, and a single dose, quick onset, unfortunately can even lead to psychosis. And then the new challenge that we have now is marijuana vaping. Vaping THC, of course, doesn't produce that telltale smell. You can pretty much do this without being detected, just like you can use a Juul pod to smoke nicotine. And they will consume higher concentrations of THC simply because the oils that are used in the products to vape are very, very highly potent. And actually, the devices just look like regular Juul pods in terms of what kids can use to vape marijuana. So 2019 national data on this issue is as follows. So daily marijuana vaping was up to 3.5% in 12th graders, 0.8% 8th graders, which I still find very frightening. And past 30-day use in 8th graders was almost 4% and up to 14% in 12th grade. And this, as you can see, between 2018 and 2019, that steep rise across these age groups in vaping of THC products. And then edibles have entered the market. Again, they're marketed to teens, cookies, brownies, candy. These are also very potent. The most important thing about these is they have a delayed onset of action. So what that means is that because the high that these kids get is not immediate, they'll start consuming it till they get the high. But by the time they've gotten that high, they have actually consumed a large amount of THC. And this is what, they look like. Again, it's just something that a young person will gravitate to want. And some of them are actually, made to look like other brands like Pop-Tarts, some of the cereals and candy bars and gummy bears that are out there. And a very important thing to remember, and this is a trend that worries me a lot because I see this a lot when a lot of teens will fill out screening questionnaires for substance use, and alcohol and marijuana are commonly mixed. And it's really important to know because you'll increase the level of THC in the user's blood if they drink alcohol with it, and obviously leading to more likely to get anxiety, nausea, vomiting, memory impairment, fatigue, hallucinations, and decreased coordination. Vaping had made the media quite a bit before the pandemic started. And I think we've not, whether we haven't seen as much or aren't keeping track, I don't know, because the CDC stopped recording data as of February 2020. But, this young athlete actually made his story public, and it was in Time magazine, just started with casual juuling and developed an addiction to both nicotine and THC. He ended up requiring a double lung transplant. You can see the x-ray on the right to what his x-ray looked like. This is his normal x-ray with black representing air in it. And then this is his x-ray completely inflamed and whited out from vaping marijuana and THC. And he really tells a story about how, he pretty much lost almost everything. But by January 2020, there were 2,800 hospitalizations and 68 deaths from vaping. And the reason I bring it up, it's, nicotine and THC are often vaped together. So it's very important for us to be aware of this. And of course, COVID-19 sort of created the perfect storm. And, teenagers had more time on social media. We have seen an astronomical rise in depression and anxiety among teenagers, which we all know about since the pandemic started, especially in suicidal ideation among teenagers. And we've had continued availability of THC products, which they have gravitated to, a lot of them as a form of self-medication. And then when we look at data from 2020, there isn't a lot out there, but there was one published in July of 2020 in the Journal of Adolescent Health. This was a survey of 1,000 adolescents in Ontario. This was pre-COVID and then 3 weeks into lockdown. And what they found, and again, this is only 3 weeks into lockdown, so this was in the spring of last year, but the number of new users did not increase, but use increased overall. So the ones that were already using were using more. More reported using alone and having online parties with alcohol and cannabis use. So I just want to end with this picture here. Marijuana is not harmless. So, and if there's one message you want to say generally to kids is users report lower satisfaction of life and poorer mental and physical health. So thank you very much for allowing me to speak and share this information today. And I can stop the sharing.
Thank you, Dr. Medina. I think you gave people a lot of information to think about, and we really appreciate you. You were even ahead of schedule. How often do people get ahead of schedule in completing presentations? That's wonderful. We have received a few questions that were submitted when folks registered, and I also wanted to just acknowledge that that folks are welcome to also continue to put questions in the chat box. So we'll be happy to try to field those questions. I'm happy to try to pass those along. I've already seen a question about slides in the chat, and Dr. Medina has been kind enough to share that he will share his slides with folks. So we will send those out. So some of the questions we've gotten, and I know you touched upon this a little bit in your presentation, but maybe you could expand a little bit more. For parents who have athletes as kiddos, this particular parent said that their son's an athlete and wondered if smoking pot regularly could affect their teen's lung capacity and stamina on the athletic field. Did you want to respond to that a little bit more?
Sure, that's a great question. So as mentioned, we do see, that smokers of marijuana and kids who are vaping marijuana do report more respiratory symptoms, including coughing and wheezing. And there actually was a study, which I'd be happy to share later via email, that actually looked at lung capacity, did pulmonary function testing on adult marijuana users, and found that their lung capacity was lower and they had poorer results on their pulmonary function tests. Because it's an irritant to the airways, and our airways are our first defense against viruses as well. And so that immune response is blunted, so they're more likely to get respiratory infections as well.
Thank you. What about the use of cannabis for ADHD and anxiety? This individual wanted to know, are there uses for that in teens? And are there side effects that should be noted, particularly on gut health or metabolism?
That's a great question. So, as we talked about right now, the studies are not there on CBD and how to dose it or how to use it for any conditions in teenagers and children. So that's a hard question to answer without the data right now. It's also that a lot of these products are not regulated. So my advice to families is usually that, you really want to be cautious about not just CBD, but any product that's out there that's a natural product before you take it because of potential harm that hasn't been studied. And what we do know is that we do know the harms that THC has already in kids, based on the data that we have about the actual effect on IQ. It actually, if you have a product with THC, it's more likely to make their attention worse, not better. Which we have seen over and over again in studies on monitoring teenagers. So my advice to parents is right now we just don't have the data to support using these products for those conditions. And if it's research and later it comes out, then we can definitely start looking at that more. Okay. And then in terms of, I think the gut health issue came up, and I'm not sure if that was more, does it promote healthy gut or anything like that? But what I do want to say is that it does have that real effect of cannabis hyperemesis now, which has been looked at. So whether it has another beneficial gut effect, that I do not know.
All right, thank you. I know we're getting some questions in the chat too, and I appreciate folks having such wonderful and thoughtful questions. One that I'm going to actually jump to, because I think defining words is always really helpful for folks, because the word psychosis was used and somebody brought up that it might not be clear to everyone what that is, what it means, and unless you've experienced it yourself or observed it, it can be hard to really know what it is and why it could be problematic. So could you just expound on that a little bit, Dr. Medina?
Of course. So psychosis is when a person loses their perception of reality. So this can be visual hallucinations, auditory hallucinations. I have had, patients who have used cannabis report, there are these bugs on me that I can't get rid of, or I had a patient who was convinced that someone was out to abuse him in the middle of the night. So it is any deviation away from perception of reality. And the real danger of it, of course, is that it can lead to long-term psychotic disorder like schizophrenia. So I hope that helps folks understand what that meant. Some kids will get very, very anxious after, a high ingestion of THC, and that's very different from psychosis. Sometimes it's just horrible, horrible anxiety they think might be a hallucination. So it is important to differentiate from the two.
Thank you for that clarification. This question we received in registration was from a person who was wondering about their college-age child who's been using marijuana regularly since their teens. The reports of marijuana lowering IQ is of concern to this parent, and this parent wants to know, is that actually true? Is it reversible? Could you share a little bit of information about that?
And that's a tough one because the studies followed these people into adults and did a lot of the studies when they were beyond their college age years, when they said that this was irreversible. So, I don't know if there's good data on whether, short-term use in high school leading up to college can have a longer term impact on IQ. But I think the best thing for any teenager or college age student who is using is to get the resources to stop so we can prevent any further lowering of IQ. So those points of 8 was much later into adulthood.
As a follow-up to that, another registrant asked if, in terms of just general long-lasting effects of smoking recreational cannabis, and I don't know if it matters the delivery system, this person phrased it as smoking recreational cannabis, but I'm guessing the question might have been about cannabis use in general. What other long-lasting effects do you think should be reiterated? And is there an age where where the risk is mitigated? Are the 20s a little bit safer than those teen years?
Great question. So, what we can say is yes, probably, again, the more data we can get, the better. But looking at, other substances like alcohol, for example, we know that, if you start using alcohol younger, you are more likely to develop an alcohol use disorder. And same thing with marijuana. When that vulnerability of that brain, under the age of 25 is always an age that gets used a lot, which I think is a reasonable age to consider, that you are less likely to suffer the consequences of marijuana use in terms of developing a dependence or some of the other, neurological side effects if you're over 25, versus when that brain is so vulnerable in development. I mean, that prefrontal cortex, we know, makes those connections into your 20s. So I think that can help a little bit.
This is an interesting question in the chat that I know we've had anecdotal conversations about here in Natick, and I'm sure our colleagues in Needham have, about, what's the impact of the pandemic on youth substance use. And the question in the chat is about, is it worse now with the hybrid, academic models where students aren't in physically, present in school every single day? There's less social connection to other people. Are you seeing or hearing increases in youth use? And what are the impacts of COVID too? I mean, I've certainly heard, debates about, does cannabis use or vaping in general put a young person to make them more vulnerable to COVID? If you could talk a little bit about the impact of COVID on all of this, would be really helpful.
Yeah, absolutely. Absolutely. So I'm going to answer the last part first, if that's okay. And then we'll go on to the more detailed discussion about what. So because of the injury to the lungs from vaping, there was actually a study that showed a significant increase in developing COVID-19 and serious COVID-19 illness in teenagers who were smoking or vaping, and both nicotine and THC. And 2 reasons. Number 1, the direct effect on the lungs. But number 2, they're more likely to share devices or joints or anything that they use in terms of the delivery of the product, as you said. So that is a definite that they're more likely to get sick from COVID-19. In terms of the direct impact, the data isn't there yet. I think a lot of towns have delayed their YRBS studies as well this year, so we don't have data. But what we're seeing anecdotally in our clinics is more use. And it goes back to more free time. It does go back to more access to social media. And it does go back to increased depression and anxiety. All of those things are definitely setting us up probably for seeing more and more of this. The hard part is because of the initial months of lockdown, people didn't seek medical care right away. So I think the numbers in terms of what we're seeing may not be very accurate. But in terms of the screening that we screen at every adolescent visit for substance use, and we are seeing more kids, checking those boxes for sure.
Do you, and this kind of again is another follow-up based on another question we've received. Can it harm or help kids that already experience anxiety and depression? I know you've already talked about that a little bit. Maybe you could reiterate, because I think this is the space where people get really, parents and adults get really concerned. Is it something that can provide some temporary relief, provide a coping strategy that does perhaps seem less risky than, say, alcohol use, or prescription medications? Because I've certainly heard reports from parents who are concerned about putting their teens on pharmaceutical drugs and would rather use something that they consider to perhaps be less risky. So could you talk a little bit more about those youth who might already be experiencing anxiety and depression and what impacts cannabis could have on them?
That is a great question. And I think those are all really good points to bring up, because obviously with such high rates of anxiety and depression, we want to be able to offer kids safe treatment for these conditions. So what we know is right now we have no data to support that THC or even CBD are treatments that will cure anxiety or depression or help children cope with anxiety or depression. The way I look at THC is it is going to make you feel better. So I acknowledge that smoking THC or using any THC product is going to make them feel better in that short term, because they're going to get that dopamine surge and they're going to feel better. The problem is what happens once that dopamine surge is gone. And then they're going to want more of that same product, which is going to develop an addiction. And then you are more likely to experience all those harms that we talked about as well, whether it's intellectual functioning, the real risk of developing some kind of hallucinations or psychosis, or, risk of some of the physical side effects that we talked about. So, I acknowledge that it can help in that short term, but long term, this is not a solution for you because of all those harms that it can pose. And, I do really respect a lot about people not wanting to use pharmaceuticals. And I think that is absolutely that is something that we need to keep saying, is we want to avoid using, any short-term pharmaceutical for anxiety should never be given to a teenager, because they can lead to addiction just as much as THC can. So, I always say this in these forums, please do not ever accept a prescription for benzodiazepine like Xanax or Ativan or any of those. Those are not appropriate treatments for children with anxiety and teenagers with anxiety. And what is? We know that therapy, we know that cognitive behavior therapy, finding the right connection with a mental health clinician is key. Lifestyle, exercise, sleep. And again, a lot of that has been very disrupted for these kids during the pandemic. So we really have to work harder to offer them these solutions. And again, looking at pharmaceuticals, there are safe pharmaceuticals we can use. So for example, SSRI, serotonin selective reuptake inhibitors like Prozac or Celexa, those are actually very safe, and those are not addictive, and those can be monitored very carefully with dosing and, having kids wean off them when they're ready. So there are safer alternatives, and that's what we want to offer them. And I do make the analogy with THC with alcohol. Alcohol will make your worries go away temporarily as well, but it's not a solution we can use right now for anxiety or depression.
Great. I appreciate you referring to cognitive behavioral therapy as an important resource folks should know about. And somebody in the chat actually asked what that was. So could you just expound upon what that is?
Absolutely. So there are clinicians who will offer, kids the idea of, all right, let's work with you on finding out why you have anxiety and how I can train your brain to cope with this anxiety, to cope with this sadness, and giving kids real world tools to use. And it works really well. And there are I mentioned that as an example, and a mental health clinician could probably answer this better, is there are other modalities of therapy as well that work as well.
This question's a rather long one, so if it's okay, I'm just going to read it as written and not try to paraphrase it for the person who submitted. It's again going back to this question about cannabis and mental health and impact, with special consideration around the topic of kids who might have a genetic predisposition to a mental health diagnosis, such as bipolar disorder. How can cannabis, this person says, accelerate the situation, impact the situation? And along similar lines, cannabis causing psychosis, how do we talk about family mental health history with teens so that they can understand heightened risks that they might be at, and which is problematic with families as it may not have been diagnosed previously or understood or masked with euphemisms? How do we talk about things and not use scare tactics? How do we raise their level of understanding and risk taking when talking about family predisposition and existing mental health diagnoses in a family?
Great question. So I always make the analogy to physical health, and I think that goes a long way. So if you have a family history of type 2 diabetes, if you have a family history of early heart disease, my nutrition conversation with you it's important with everybody. So the discussion particularly pertains to you because we know that you had an uncle who died of a heart attack at 55. I know that your mother has type 2 diabetes. So I bring it in as a discussion I have with everybody. So the universal discussion about mental health and substance use, and family history is obtained from everybody. So that is something, I would hope that parents would offer, just as they do with physical, diagnoses, is about bipolar disorder, substance use, and depression, and suicidality. A lot of people, you're right, are not very forthcoming about it, but I think making the analogy to physical health really helps because it will help me treat your child. And so there's no judgment on this at all. It's just another illness. And to the first part of that question, I think any child that has predisposed to an underlying mental health illness is more at risk to develop worsening of those symptoms with the use of THC, because we're taking away their brain's own functions. And again, it's that important early detection of that mental illness. So knowing about family history, you're more aware. Early detection of an early appropriate treatment of that mental illness is key. And especially when it comes to psychosis, if there's a family history of schizophrenia, that teenager has a much higher risk of developing psychosis from cannabis use, especially. So.
Thank you. This next question is regarding edibles, and the person thought that they heard you say during your presentation that there had been deaths that had occurred in the country from edibles. Is that the case? And could you speak a little bit more to that?
It was overdoses, not deaths. I'm sorry, I meant overdoses and not deaths. I think it just wanted to, I think that sometimes the terminology is difficult. When we say overdose, we don't automatically mean death, but there have been overdoses in even toddlers and ingesting large amounts of marijuana from that. So they have to be watched for respiratory function, for any acute neurological changes that might occur from ingestion of that THC.
So when you're talking about overdoses from any substance, you're talking about where the body has so much of a substance in it that it's having difficulty processing that substance?
Right.
Okay.
And I think the death was a secondary result of psychotic events.
Okay.
Was. So there's an overdose. There's definitely sort of a, either they can get very sleepy or very, not be coherent from their ingestion of a lot of marijuana, but, acute psychotic events can do that. And there's been, anecdotal evidence of that. So.
Mm-hmm. Just trying to make sure that I'm getting to all the questions in the chat, and I appreciate you being giving us so much time for Q&A here, Dr. Medina. Another clarifying question about depression after alcohol use. Were you saying in your presentation that there's increased depression after pot use as well, similar to what happens with alcohol?
Yes, absolutely. So that sort of long-term withdrawal, we talked about acute withdrawal from cannabis with some of those physical symptoms, and the long-term withdrawal ends up being depression, just like it is with alcohol.
Okay. This person mentions that there was a slide that indicated withdrawal that ended with treatment. And this person wants to know what kinds of treatment are used for cannabis addiction.
So there isn't a lot out there. So, a lot of, we talk about opioids having, medical assisted treatment for opioid use disorder, some evidence for alcohol use disorder as well. So marijuana really relies on motivational interviewing, a lot of, using using mental health treatment modalities, and possibly treating, the underlying depression with a depression medication.
Any thoughts on how we can get better at screening and identifying depression and anxiety? And I know you talked a little bit about CBT, cognitive behavioral therapy, but any other thoughts about how we can provide help and coping skills. And I don't know if this is a kind of a question about kind of us in general, adults who care about young people, or if we're talking about it in a school context or parental context, but any thoughts you have in that space?
Well, I think it's all of us together. I think,
Right.
the idea that it takes a village, it definitely takes a village. And I think it's really, the first thing is just talking to your kids. It's that important time, whether it's, before they learn how to drive, that time you're driving them somewhere, find out what's going on in their lives, dinner time, wherever you can get information from them and find out what they're feeling. And in terms of sort of more large scale screening, most pediatric offices now will screen for mental health issues at every well visit. So there's the PHQ-9, which is a really good depression questionnaire that is used now pretty routinely in primary care, can screen for symptoms of depression. And I think a lot of places are now using SBIRT, or substance use screening, as well. Schools probably took a pause on it this year, but had most school systems to start to implement that, I believe, last year as well. So.
As a follow-up to that school question, I actually don't know if any of us on the call can explicitly respond to this, but one person in the chat was asking how schools are preparing to assess and address use and possibly increased use for students who may be returning to school shortly. And I don't know if anybody from Needham has any knowledge about what Needham public schools are doing in that space. I know that certainly in Natick, we, similar to Needham, we use the Metro West Adolescent Health Survey every 2 years and administer that to just assess general, reports among young people of youth substance use. And we usually each year do the SBIRT screenings at the middle and high school levels, which is something that schools are doing statewide. But I know SBIRT stands for Screening, Brief Intervention, Referral for Treatment. And so those are usually conversations where staff are actually screening youth on any substance use to identify those who might be at higher risk and who might need some additional resources. I know that COVID and the impact of the pandemic has delayed a lot of those assessments, which I know Dr. Medina mentioned with the YRBS survey too. So I can't speak specifically to what schools are doing in preparation for the students coming back. I don't know, Dr. Medina, if you've had any conversations with school districts and could respond to that.
Not yet. I think so much of the focus has been on increasing in-person learning, in terms of preventing spread of COVID, that I think this has, unfortunately, this very, very crucial thing has now taken a backseat. So not that I know, but I do know that in our school district, we were planning to go full with screening screening the high school students for substance use, but COVID put a stop to it. So.
One person also asks about when pediatricians ask about family history. They acknowledge that they answered a lot of questions about family history when their child was an infant and never got asked again. Is that something that that pediatricians are considering in their approach to working with families?
I'm hoping that that's there. There are, I think, with electronic health records coming in, it's always available on the screen for them to look at, which is good. But I know that in our clinic, we do have there been any changes in family history every time you come in that once a year? So there is a little checkbox there at some point, I think, has there been a change in family history? And, I think that given the sheer number of kids that go through mental health issues, it almost inevitably comes up again at some point anyways, if there is a family history. And I think the big thing is that I encourage parents to talk about it and not feel ashamed about that issue. If there was, a history of alcoholism or bipolar disorder or anything in their family, to be very upfront with their kids, because the more they know, the better.
Absolutely. I know we're getting tight on time, so I might make this the last question, and hopefully we've gotten through most of them here. But this question is regarding teens and the research. Does it show any use in terms of gender? So difference in overall use or frequency or impact by gender, knowing that there's a difference in general development of the frontal cortex and executive functioning in boys versus girls?
That is a good question. I don't know if a lot of studies have stratified it to that degree on gender. I know that if we look at the state data, which I have not looked at recently, there are some gender differences, but I don't think that they're really that different overall. And I think we probably had an increase in male use, but I think we're now more closer to being even in terms of males and females using cannabis.
Thank you for responding to all those questions, Dr. Medina. As we mentioned earlier, Dr. Medina has been kind enough to share his slides with us, so we will be sending those out for folks to reference after this presentation. And I know Monica already put a survey link in the chat that we would invite and encourage folks to complete when you get a chance today. If you can, right now, you're welcome to click on it. So that we can get feedback from folks about what was helpful about today's presentation, what more information you might want to get, because we certainly, both in Needham and Natick, I know, want to make sure that we're providing programming and information that folks find beneficial, and that we continue to build programming that folks want to hear about. So we really appreciate all of the dynamic questions and thoughts folks have been putting in the chats, and are so glad that folks found this hopefully to be informative. So thank you, Dr. Medina, for your time today. It was really great. Karen, do you want me to explain how we're going to be doing the breakout rooms, or did you want to provide that segue?
Thank you, Katie. Thank you for moderating. So definitely, I appreciate that. We are actually going to have a few updates from Nina. We have a couple of upcoming events that we wanted to share with people. And one of them is sort of a continuation, if you will, from this discussion with Dr. Medina. And Nina will share a little bit more about that on the segue from this topic. And again, thank you for the survey, Monica. We encourage all of you to take that. And Dr. Medina, thank you. We're so appreciative and grateful for the time and expertise you've given us all today, especially with all of our questions as well. So thank you very much.
Well, thank you all for your commitment to the well-being of your kids. That's really, what it's all about. There was a quick question in the chat that said, given teenagers short attention span, what are the bullet points? And that last slide had those bullet points, but I care about you. I care about your physical and emotional health and your future. I don't want to punish you. I'm here for you. I think that's how starting every conversation about any substance use talk is great. And if they're using, support them, don't punish them. Those are my bullet points about it. Great.
Thank you. Those are perfect takeaways. Thank you. I'll turn this over to Nina.
Thank you, Dr. Medina. I'm going to put 2 flyers in the chat for upcoming events that everyone is welcome to. So the first is an event on understanding teen depression in collaboration and partnership with Families for Depression Awareness. So it'll be led by a licensed mental health clinician, and it will also feature teen speakers who will be sharing their personal journeys. And as Karen mentioned, we also are having a follow-up event to this one, and the title of that one is called The Tipping Point: When Youth Use Becomes Addiction. And so we're really looking forward to that panel presentation with Michelle Lipinski, who is the principal of North Shore Recovery High School, who was featured in the MTV show 16 and Recovering, as well as a graduate of North Shore Recovery High School, and Maureen Kavanaugh, who is an author who wrote the book, If You Love Me, A Mother's Journey Through Her Daughter's Opioid Addiction. So the links to register for those events are available on the flyers. Again, everyone is welcome. And I'm going to put the link to the survey once again in the chat. If you have any questions about either of those upcoming events, you can email me and I will put my email in the chat as well.